Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our bi-weekly update on the COVID-19 pandemic. So, as you've seen in the news, the virus is ravaging the entire country. Maryland is doing somewhat better than many other states, but our hospitals are getting fairly full. As of this morning, we have the most COVID-19 positive patients in Maryland hospital beds as we have ever had. There continues to be a bit of a silver lining here in that a smaller percentage of patients who are sick enough to make it into the hospital are requiring intensive care. At GBMC, we have 40 patients who are COVID-19 positive, and only a few of those requiring mechanical ventilation. So our experience is consistent with the rest of the state. You may have heard that the new mayor of Baltimore, Mr. Brandon Scott, has said that Baltimore restaurants must close to both indoor and outdoor dining as of 5 p.m. this Friday. That seems harsh. I, like all of you, enjoy going out with family and friends to dine, but we're going to have to just keep this in perspective. With the rate of disease climbing in the community, we must do whatever we can to stop that. So-called lockdowns, which are not well accepted by many people, are necessary in order to assure that we are staying socially distant from one another. We really need to minimize our socializing to going to the store or to the doctor's office when required. This, along with wearing a mask and washing our hands, continue to be the only effective strategies for mitigating the pandemic. Now, there is good news. The governor of Maryland this week announced that Maryland hospitals will begin getting vaccines next week. Of course, that is assuming that the advisory committee at the Food and Drug Administration gives the emergency use authorization over the next couple of days. Once GBMC gets doses of the COVID-19 vaccine, we will start immunizing people at the highest risk. Who are they? They are doctors, nurses, and other clinicians in the emergency department and in the intensive care units, and then doctors, nurses, and other clinicians caring for COVID-19 patients in other areas of the hospital. These are the folks who put themselves at risk every day, and they are the ones who we most need to protect. After that, first responders in the community, the rest of the healthcare community, and people with chronic disease, and the elderly. And then finally, the last group will be generally healthy people in the community who are not elderly. How long will this all take? We don't really know. The hope is that we could get a good portion of the community immunized by late spring. So stay tuned. That is the good news. Now, you may have heard that GBMC has been victim of a ransomware attack. I want to thank all of my colleagues at GBMC for continuing outstanding care of patients. Our computer systems are down. Our IT professionals are working with experts to reinstate them. For now, we are documenting things on paper. I want to assure every member of the community that people are safe at GBMC. I again want to thank our people. In the face of the pandemic, to also be hit with a ransomware attack is quite stressful. I walk around our units both day and night And I am just so gratified to see the resilience of our people. They're continuing to work hard, and they're continuing to treat everyone the way we would want our own loved ones treated. Now, if you need to contact us, please go to our website at www.gbmc.org, and you will be able to leave messages for your caregivers, and I assure you they will get right back to you. So please be safe, wash your hands, wear your mask, and stay at least 6 feet apart from others. Thank you very much.